Welcome to this educational recording on the topic of applying the model for improvement to improve assessment of home safety concerns. The Catch Rural Falls program is supported by the Nebraska Department of Health and Human Services, Office of Rural Health, through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch Rural Falls program is led by myself, Vicki Kennel, and my colleague, Dawn Venema. We both are faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am an industrial organizational psychologist with expertise in quality improvement and organizational science. Dawn is a physical therapist and brings the clinical perspective of fall risk reduction to our team. The educational objectives for this recording are the following. First, to describe the model for improvement. Second is to guide you in creating an aim statement for your efforts to improve assessment of home safety concerns. Third is to help you think through and establish outcome process and/or balancing measures for your efforts to improve assessment of home safety concerns. And finally, to help you identify specific changes that you can test to improve your assessment of home safety concerns in your clinic. The model for improvement was developed by Associates in Process Improvement and is widely promoted by the Institute for Healthcare Improvement, otherwise known as the IHI. The model for improvement is based on three fundamental questions. The first is, what are we trying to accomplish? This entails making sure we understand the problem at hand and trying to set an aim to guide our improvement efforts. The second question is, how will we know that a change is an improvement? This requires identifying the data and the measures that we need to know to help us understand if the changes we are implementing are actually leading to some sort of improvement. And the final question is, what change can we make that will result in improvement? While all changes do not necessarily lead to improvement, all improvement does require change. So in this step, we identify and select changes that we anticipate will help us to address the problem and help us to achieve our aim. These questions for the model for improvement are then typically followed by a cycle for learning and improvement that can be repeated multiple times, otherwise known as the Plan, Do, Study, Act cycle, PDSA cycles for short. This cycle promotes a trial and learning approach to improvement efforts with encouragement to test an idea rather than do an extensive analysis. We will cover the latter half of the model for improvement, so the PDSA cycle approach, in a separate presentation. The first question for the model for improvement is, what are we trying to accomplish? Within this question, we want to define an aim for effort. And the purpose of doing so is that aim statement really helps to set a direction and the purpose for the entire improvement initiative. Overall, our aim statement should hopefully help us align the work with things like organizational priorities for improvement. Will help us to think about and focus on the impact of our improvement effort. And we certainly want to engage relevant stakeholders to help support the work as we're both developing the aim statement, but also implementing and testing the changes that we hope and think will result in some sort of improvement. So once a specific problem or the issue that you want to address has been identified, in this particular case, we're looking at the example of conducting an assessment of home safety concerns in the clinic. Your team can then establish an aim statement to help guide your overarching improvement efforts. So an aim statement is a clear summary statement of what your team hopes to achieve in a measurable way over a specific amount of time that will hopefully include the magnitude of the change or the degree or extent of the change that you hope to achieve. This statement serves as an overarching guide for your work and importantly helps to establish what success looks like for your improvement efforts. So a clear aim statement can help you to keep the project on track, can provide some overarching guidance on some of the processes that you might want to explore, the measures and metrics that you should identify, and where you want to focus your efforts. So to help you with creation of an aim statement for your efforts to improve assessment of home safety concerns, we wanted to share with you a couple of example formulas for drafting an aim statement. Those are provided here on the slide. In many cases, you might include toward the end of the aim statement the what, or like the what changes you intend to make to help achieve this aim at a later time if those aren't yet finalized at the time of setting the aim. And those changes may certainly adapt as your work evolves over time. So we've created an example aim statement, just again as an example for the assessment of home safety concerns. For reference, as you think about creating your own aim statements for your efforts to improve assessment of home safety concerns. So in this particular example, the example aim statement is to increase the rate of assessment of home safety concerns from 25% to 75% over the next 6 months for all adult patients ages 65 and older who visit the clinic and screen positive for fall risk. The second question for the model for improvement is how will we know that a change is an improvement? And in this particular component, here's where we're really starting to focus in and dive deep into measurement. So identifying the data that you need to help you determine if the changes that you're going to test are actually leading to some sort of improvement. We really want to focus on collecting data that is useful here, useful to help you establish not only a baseline for kind of like what's the current state of this particular thing that we're trying to test. In this example, it's assessment of home safety concerns, but then also data then that you can collect and track over time to see if you are in fact making changes that are hopefully helping you improve the assessment of home safety concerns for your relevant patient population. So when we're thinking about measures, some key things are making sure we name the measure, and also to be clear, are we looking at a number? Are we looking at a percent? Are we looking at a rate for this particular indicator? But probably one of the most important components for the measurement piece is making sure that we have a clear operational definition for your measure. So a very clear numerator and a very clear denominator for that particular measure that you're tracking. When we think about the numerator, this really reflects the count of the events or the outcomes that you're trying to improve. Another way to think about this is like the specific result that you're measuring or the subset of your denominator that experienced what it is you're trying to improve. Your denominator reflects the total population or the opportunities for that event or that outcome to occur. In a sense, you can kind of think about the denominator as setting the scope, like the broader scope for your measurement. In addition to having clear, names and operational definitions for your measures, we also want to make sure you clarify with your team, like who's going to collect the data, how often are you going to collect it, what's going to be included or excluded, and what's the source of the data? Where is this data going to come from? One other thing we typically think about when we think about measures is it's common in quality improvement to have measures fall into one of three categories. So outcome, process, and balancing measures. Outcome measures are oftentimes the measures that we typically focus on or that we think about first. So almost all improvement activities are going to include at least one or more outcome measures. So our outcome measures are those that help us indicate how the system is performing. So what's the overall result or the impact on our patients, our employees, or other stakeholders. So an example outcome measure for an effort that's focused on improving assessment of home safety concerns might be the percent of adult patients ages 65 and older with a completed assessment of home safety concerns documented in the EMR. And we're operating here under the assumption that these are patients who screened positive for fall risk, and as such, they were then eligible to be offered an assessment of home safety concerns. Process measures follow. These are often logically connected with the outcome measures. So with our process measures, these measures are typically going to show improvement before we see improvement in the outcome measure. So with this in mind, process measures oftentimes serve as an early indicator of whether or not our changes are in fact improvements. So process measures help us understand if the parts or the steps in the system are performing as we planned or intended them to. So an example process measure for a project focused on assessment of home safety concerns may be the percent of adult patients ages 65 and older who are asked about home safety concerns using a standardized checklist during their appointment. And again, we're operating here under the assumption that this adult patient population were those that screened positive for fall risk. Finally, we often look at balancing measures. So one way you can think about balancing measures is that they can help us to detect unintended consequences of the change that we made, for better or for worse. or they can help us to track events that might serve as an alternative explanation for the improvement. So in other words, maybe we're seeing changes in our outcome, but they could be explained by something other than the change that we were testing or the change that we made. So an example balancing measure for a project focused on increasing assessment of home safety concerns could be something like the average length of the appointment time with the addition of the assessment of home safety concerns. So an unintended consequence of incorporating a conversation or an assessment of this might be that the clinic appointment time tends to run a little bit longer. And then is that in turn affecting wait times or start times for other appointments? The third question for the model for improvement then helps us start to think about change. So, what change can we make that will result in an improvement? While all changes are not necessarily going to lead to improvement, we do know that all improvement is going to require change. So, we want to think carefully to identify and select changes that we anticipate will help to address the problem and help us to achieve our aim. Oftentimes, the changes that we want to make for improvement are relatively clear and straightforward. So, for example, in the context of assessing home safety concerns, perhaps you just want to, select a standardized guide or a checklist that staff can follow for this assessment. Maybe you want to change the guide or the checklist that you use for the assessment. Maybe you want to change when you do this assessment during the patient's appointment. Or maybe you want to improve kind of patient education or take home materials that a patient may take home with them so that they can go home and further assess home safety concerns in their home. So they're that kind of like logical thinking, looking at what others have done are oftentimes sufficient to help us come up with ideas for change. We can also use things like, flow charts or cause and effect diagrams, particularly if we're looking at changing processes, or we want to dive into some sort of meaningful effect, but we think that there might be multiple causes that are contributing to it. The other component that I want to introduce you to on the next slide is just the idea of change concepts, and how those broader change concepts can sometimes help to inform some additional ideas for improvement. So when we're thinking about change here, the goal is to think about changes that we can use, that we can then test in small tests of change. Long term, we're hoping that this helps us to develop some specific interventions that through testing and through identifying data that gives us evidence that this change is in fact leading to improvement, might be something that we can then further adopt and sustain and use over time. So change concepts is another thing I want to review because these are kind of broader, I would say buckets or categories of changes it's like a general notion or approach to change that's been found to be useful to help people develop and think about specific ideas for improvement. So I just want to introduce some of these change concept ideas and how they could be thought about in relation to ideas for change to help improve assessment of home safety concerns. So for example, the first one focusing on improvements that you could make to the design of the service. You may be asking questions like what approaches to to assess home safety concerns works really well for your patient population. To enhance the patient relationship, the question might be, how can you better understand and respond to the patient's needs? So what's your patient population receptive to about assessing safety concerns in their home? And what might be necessary to help overcome any resistance to participating or having an effective dialogue about some of the concerns that they have about safety in their home? Time is always a priority. So, how can you streamline your assessment of home safety, knowing that that process could take a variable amount of time, that some people may have more home safety concerns than others, and some may be less willing to engage in the conversation or share much information with you about that. Trying to reduce variation in the process. So, how can you standardize the process so that all eligible patients do receive an accurate assessment or at least a thorough assessment of home safety concerns? thinking about how you can change your workflow so that this process works and flows smoothly. So that might be questions like, when is best in the patient's visit to complete this assessment? How are you sharing the results with medical staff? When are the results documented into the EMR? And then finally, you can also think about the broader work environment. So what needs to change about the environment to be able to support improvement in this space? So a question here might be things like what information or training or resources are needed to help support changes to incorporate assessment of home safety concerns. So in the absence of having some really concrete specific ideas, change concepts can be really useful to help your team, focus on some specific broader areas or aspects of change that could then be dived into a little bit more depth in relation to the specific area that you're trying to focus on for change. So in summary, the model for improvement can guide your efforts to think about what you can do to try to improve assessment of home safety concerns. A clear aim statement is really critical. This can help to guide your work and can help to you inform your team what success might look like for your improvement efforts. Taking the time to really clearly define critical measures, particularly outcome, process, and balancing measures that can give you the data and the information that you need to help inform if you are making progress toward or if you have achieved your aim, and to help you really start to quantify the impact of your changes. And then also thinking carefully, but also broadly about some of the specific changes that you might want to test in order to improve efforts to address home safety concerns. Finally, there are a number of resources that are cited in this presentation. These all come from the Institute for Healthcare Improvement. These are resources you can use to help support developing an aim statement, developing various project measures like outcome, process, and balancing measures. And there's a worksheet related to the use of change concepts that you could use to help inform specific change ideas to help with your effort to assess home safety concerns. So to access these materials, you simply need to visit this link online, and then the IHI asks for your name, your organization, and your email address in order to download the materials for free.